our session. Our session on the exposure, on the environmental exposures. I guess we have been talking about the exposure throughout the past day and a half, right? And the purpose of this session, I think, is going to be more on the environmental exposures. If we think about what we are exposed to from the environment, from the air we breathe, the water we drink, and much more, there are thousands, if not millions, of chemicals that we do ingest, that become part of our system, that affects our metabolism, our system, and very clearly can also affect different organs, including the brain. So I hope that at the end of the 2 days, we can bridge a gap between what is being described at a molecular level of defining all of these influences, including the issues we are addressing, diversity and disparities. So, all right, so we have three great speakers for today. The first speaker is Dr. Julia Kravchenko, is an assistant professor in Department of Surgery and Department of Population Health Sciences at the Duke Medical Center. Experience including analysis of geographical racial disparities in health outcomes across the United States. Of course, the specific focus is population-based modeling of health outcomes, analysis of treatment effectiveness, and the influences of the environmental exposures. Please.
Okay, thank you for the opportunity to present this workshop. I'm very happy to share with you some recently updated data on health and environment, especially with a focus on Alzheimer's disease risks. So if we will look at environmental exposures potentially associated with high Alzheimer's disease risk, we will see that it includes many components like toxic metals, antimicrobials, industrial chemicals, air pollutants, and agricultural chemicals. And exposures occurring as early as in utero and during child growth and development, they can be associated with high risk of Alzheimer's disease later in life. And before I move forward, I would like to stress the importance of microglia in this process as environment and Alzheimer's disease interactions. So this is the resident immune cells of the brain, and they regulate brain development. They maintain neural networks and injury repair. And exposures to various environment toxins, as we see here, they impact this microglia and are associated with increased risk of neurodevelopment disorders, including neurodegeneration. And the literature on this topic is growing, but mechanisms of interrelation between environment exposures and microglia remain largely unknown. And again, it's important to stress that this effect of microglia is early life effect, and late in life, it could be the impact such as development of Alzheimer's disease, but it starts very, very early. And there are numerous environment risk factors which could initiate the development of Alzheimer's disease risk and disease progression. And as we can see here, multiple factors, and here, for example, we see different types of metals, trace metals. We can see them in water or in air. And also other environment factors such as diet, exercise, and so on. And we see that they could work through different pathways and through different mechanisms. And right now, clear evidence on mechanisms remain in humans still unclear. So there are a lot what we need to learn, what we need to investigate. And if we will look, for example, even at this part, little curves. So like here, we see that, how many different mechanisms are involved. And this way, when we're studying Alzheimer's disease, we need to keep that in mind, that it's more than one mechanism, even for each contaminant. For example, for one metal, we see like different pathways and different mechanisms, but there are definitely more than one metal in our environment. So this system of interrelations between environment exposures and Alzheimer's disease risk is extremely complicated. Here is another example. That's the impact of several metals, for example, lead, aluminum, cadmium, which could disrupt, regain function of microglia, which I mentioned earlier, and increase amyloid beta production and plaque formation, which is the pathogenesis of Alzheimer's disease risk. And now we will move to epidemiologic studies, epidemiological evidence. The first statement could be that, yes, literature on epidemiologic evidence amass rapidly on environment exposures and Alzheimer's disease risk. And also, the most studied till now remain particular matter 2.5, it's mean fine particular matter, and cognitive decline and association with high risk of dementia and high risk of Alzheimer's disease. Findings on other particular matter, like particular matter 10, which is larger, and some other gases, for example, contaminant, remain mixed right now. The United States Environment Protection Agency concluded that long-term exposure to particular matter 2.5 was likely to be causal in relation to nervous system act. And actually, this is a big step ahead in this area of studies, because we will talk a little bit more about causal associations a little later. But this is really point of great interest right now, because it's very important for policy, environment regulations, and so on. All the studies, previous studies, they were predominantly focused on monitoring stations, ground monitoring stations, distance to road, traffic route, surrogate of particular method and other contaminants concentrations at place of residence of individual. The more recent studies are based on modeling data, predominantly using satellite data. Both approaches using monitoring data and satellite data, they have their pro and contras. For example, satellite data, they can cover the whole territory without missing measurements, but air monitoring data, they measure the level of air contaminants near the ground level where actually people could be exposed. So both are important, and it's a good scenario to consider both of them in future studies. In real life, person is typically exposed to mixture of various air contaminants plus to mixture of air contaminants and other contaminants, like in water, in soil, in food, and so on and so on. And this area remains partially studied, including the associations with Alzheimer's disease risk. What's also important when we're studying human populations is the health effects of air pollution and Alzheimer's disease risk. They vary by social economic status. And these factors may be also tied to cognitive reserve. These way they intervene with environment and Alzheimer's disease risk interactions. So if we will now talk about particular matters, the most studied among environment contaminants in relation to Alzheimer's disease risk we see how many different pathways, dermal, ocular, inhalation, ingestion, and they work, like together. How many pathways lead to contamination of human body with particular matter. For Alzheimer's disease risk, it's important to remember that particular matter could penetrate through olfactory epithelium, travel deep into lungs, enter blood circulation, and cross the blood-brain barrier, which is a very important component of Alzheimer's disease risk. This is the blood-brain barrier, and if we will talk about particular matter, fine, very small size, like particular matter 2.5, so it can go through this barrier and work as environmental antigens. They can trigger the formation, like here, of amyloid plaque, and this way increasing the risk of Alzheimer's disease. That's interesting study related to blood-brain barrier and size of particulate matter. That's a recent study on particulate matter's characteristics in past and in present. So that's Liverpool study, and in the United Kingdom, air quality improved as well as in the United States, and they also have clean air act. So they started working on improvement of air quality since mid of the last century. They decided to compare characteristics of particular matters, current characteristics and past, as well as like probably 200 years ago. And contemporary monitoring does not extend beyond 1990s. This is why they use some phones and took the elements out of these phones to look at all the characteristics of particular matters. And the finding was that yes, air quality improved, but there is rapid shift to fine particular matter. They derive from road transport, industrial activities, and air travel. Resulting from this, the generations, recently born generations of people could be exposed to higher levels of fine particulate matter during their lifetime. And if we know that fine particulate matter, it goes through blood-brain barrier, and this will be associated with high risk of Alzheimer's. So we need to pay more attention to this issue because yes, air quality is better in terms of lower levels, but the characteristics of particular matters make them so small that in terms, for example, of Alzheimer's disease, that will increase risk and severity of associations between exposure to this particular methods and disease development. So this is our study in North Carolina. Our research team, we looked at the area in North Carolina, which called Piedmont area. It's one area, because they have higher Alzheimer's disease mortality and for many decades, very high mortality. And we look here at residential populations, age 65 plus, and they have long-term exposures to elevated levels of particulate matter 2.5, exceeding the World Health Organization standard over 10 grams per milliliter. If we compare study group with particulate matters over the WHO standard and control groups with the lowest percentile of particulate matters level, we see that after adjustment for medical factors like age, race, sex, median household income, education, health insurance coverage, numbers of primary care providers, smoking prevalence, and the level of arsenic in top soil, why it's important, I will stress next slides. After adjustment for these factors, the risk of death from Alzheimer's disease in the study group was higher, like 1.35. For hospital admissions, 1.54. And what's important is that we're talking about impacts of low and moderate levels. And actually, the average level in the study group was just slightly over the WHO standard. So that provides us with additional reason to study low doses and around the standard doses and their impact on health and especially on Alzheimer's disease, because even these doses could still have impacts such as increased risk on Alzheimer's disease. This is another study based on Medicare data. And we looked at dose response patterns of particular matters, 2.5, on Alzheimer's disease risk. Because this issue discussed in many papers and evidence from the literature suggests non-linear health effects of air pollution. And what we see, if we will look, so that's like the standard WHO standard. And recently the UCDA suggested to have lower than WHO standard for United States, but we still see that even up to 6 or even for Native Americans, 5 microgram per cubic meter, we still have substantial increase of high blood pressure for Alzheimer's disease. And of course, we need to investigate, and it's our ongoing study, why Native Americans, probably different type of, as I mentioned earlier, particular matters and its components in the areas where they live. But we really need to investigate this phenomena of Native Americans, but also we see that in low doses exposures, there is still substantial increase in Alzheimer's disease in the US population. If we will focus on particular matters, constituents, we will see that different constituents, including trace metals, including black carbon, as in this study, organic metals, some other components, they have different associations with dementia and Alzheimer's disease. And here is one of the recent studies, it's 2023 study. And so that's a risk for dementia, that's for Alzheimer's disease risk. And we see that high exposures to the components of particular metals, such as black carbon, organic matter, sulfate, and ammonium were associated with high dementia Alzheimer's disease risk. And so why it's important to understand the structure of particular matters and know how each constituent impacts the risk of disease, because these would be really translatable into effective abatement strategies. And we're talking about environment regulations, environment policies. If we would know specifically in which area, geographic area, for which population group, which constituent is the highest as risk factor, the most strong risk factor for Alzheimer's disease, then we could try to control this factor, thus reducing disease risk in this area. So that's just one of the reviews, because there are many reviews right now on this topic. There are a lot of interest to this topic. And that's critical review of the epidemiological evidence of effects of air pollution on dementia, cognitive function, and cognitive decline. So that review was published a couple years ago in Science of Environment. And red means detrimental effect shows statistically significant associations. So here are cognitive function, cognitive decline. We see also neurological biomarkers. We see dementia. And we see that many studies show statistically significant associations. And the conclusion was that cognitive decline and dementia incidence are associated with exposure to air pollution. This suggested possible effect modifiers which could influence the interrelations between air contaminants and Alzheimer's disease risk. And there is a long list actually of these modifiers, which in best case scenario, we need to account to in our studies. So we see some genetic characteristics. We see pre-existing medical conditions here. We see body mass index, smoking, alcohol, sex education as surrogate cognitive reserve and neighborhood social stressors. And very few actual potential effect modifiers have been investigated in more than one study. So of course, it's a good scenario to include as more as possible within one study. What is interesting that interpretations of causal associations in this recent paper were made based on the evidence for causality of Redford Hill, which is 1965 paper, and associations between a range of evidence and effects on cognitive function in older people, including acceleration of cognitive decline and induction of dementia, are likely to be causal based on these criteria. And actually, most of the papers right now, they're still based on these criteria. Let's look at these criteria just to refresh a little bit. So that's this original paper. Let's see, Austin Bradford Hill. And in 1965, he asked the question, what aspects of that association should be especially considered before deciding that the most likely interpretation of it is causation? And he suggested 9 different types of characteristics. And these characteristics include strength of this association, consistency of this association, specificity, temporality. So as he said, which is the cause and which is the exposed. Biological gradient, so actually it's a term suggested for dose response curve. Plausibility, and what is biologically plausible depends upon the biological knowledge of the data. Coherence, the cause and effect interpretation of the data should not seriously conflict with the generally known facts of natural history and biology of this experiment, and analogs of the same situation they found in the literature. And if you saw that this analog is in literature, it would be fair to judge by analogy. So actually, as we see these 9 criteria were used and been using it till now in recent publications. But based on our seminar, based on our workshop, we can also say that we can extend this 9 criteria approach, and there are causal methods of analysis. We could apply to large population data, to large health data, and with specific focus in this case, for example, on older people with Alzheimer's disease. And here are just some examples which were already mentioned at this workshop, and that's the work of Dr. Kravchenko and his team. So this is like causal mediation analysis. So that's parametric G formula modeling. It's the power series regression decomposition technique. And some of these methods we already applied to analysis of Alzheimer's disease and risk factors of Alzheimer's disease and other diseases. And some of these methods are like undergoing We have some ongoing studies, so I will not repeat the characteristics of these methods because I believe that some other presenters already did it. But just that's the contemporary extension of the classic approach by Hill, which we had like for 70 years almost. So that's one example of our research team, like causal mediation analysis, chronic diseases as the mediators of the effects of particular matters on Alzheimer's disease risk. And we use the causal mediation analysis in a formulation one. And to clarify the role of chronic diseases, for example, we see here like the role of bacterial hypertension usually implies data of relationships between exposure to contaminants, particular metals, and Alzheimer's disease. So also, as I understand, I'm almost so we can do question. Okay, so I will try very briefly to move through this slide. So the role of nanoparticles, that's a very new area of research. And there are many mechanisms which could be associated with increased risk of Alzheimer's disease. Arsenic, so it's also now they're paying a lot of attention in terms of risk of Alzheimer's disease. It could work through comorbid diseases and several mechanisms have been suggested. In North Carolina, we have this issue in the same area which we already investigated. And we see the EPA maximum contaminant level is 10, but some people in North Carolina still live with 806 microgram per liter of arsenic in their water. So that's natural contamination because of geologic characteristics of the soil. Also, agriculture, we have different types of pesticides and people who are working with them, like vanguard workers. So they have increased risk, especially with genetic predisposition. And recent study called Tractor project in France, they proved increased risk of Alzheimer's disease and dementia in these people, especially in males who do not apply protective measures as students. And the last slide I wanted to stress is about gut microbiota and microbiota gut-brain axis, because right now it looks like our gut, it works in very tight interrelation with brain, and it's involved in microflora in gut microbes. They involved in the relations with environment exposure, thus increasing or decreasing risk of Alzheimer's disease in patients. So there are some study limitations, and we see there are, I mentioned all of them on the previous slide, but here I just summarize. We're working on developing methodologies how to overcome these studies, and we hope that step by step we will know more and more with the overcome this, and we will know more and more about interrelations between different types of environment exposures and Alzheimer's. And that's important because we can control like large populations through contaminants or water contaminants, improve their life and thus reduce disease risk. And unfortunately, exposure to many factors will continue in the future because of industry development. So we need to learn how to live. Thank you.
Thank you. One or two questions.
So excellent talk. I really love how thoughtful it is. I have one question. This is a common problem all environmental researchers face. One is people move all the time. Rich people live in poor neighborhoods. Poor people may live in like good environmentally friendly neighborhoods. How do you calculate lifetime exposure? Is it early exposure that matters, midlife exposure that matters, or the last 5 years exposure before they develop dementia? Have you given it some thought, and what's the best way to address it?
So actually, yeah, that's an excellent question because that's a reality. If we have special data sets with detailed history of residence of this person, if we have it even for the parents of this person, and we mentioned about microglia, so that will be privileged to include this information. As to the moving, usually people with lower income who live in exposed to environment injustice, they do not have many opportunities to move. Usually these communities, they're living for generations, like 5, 6 generations, and they accumulate these toxic imports. So like in utero, in childhood, and so on. That's actually one of the examples like we can use to look at like natural history, unfortunately, of development of these diseases. But for other people, there is variables like migration, changing residence. So we have these records, and we can trace in certain extent the dynamic of changing residence.
Thank you very much.